thing you're talking about, and what challenges do you face, and if you have limited resources, where do you would like to invest first, and all about your
Yeah.
revenue and money.
All right. Yeah, of course. As I said, I make a lot of business models. I love making the strategy canvas. I love, like, creating a
And you didn't
content
want to
to
lose that.
lose all that. So I said, okay, so during COVID, so we started. Best thing about COVID as an
This thing.
yeah, as an opportunity
Okay,
for a company
exactly.
was that.
Okay, good afternoon, everyone. I'm Vishnu, and this is my strategic management project in Slim Habib University. Today, we are here for an interesting conversation, and we are going to discuss about life journeys, about leadership journeys, and everything. So we are very privileged to have Miss Ambreen Bashir Haris with us. Thank you so much, ma'am, for joining us.
Thank you for inviting.
She works as CEO in healthcare, care for health, sorry, care for health, and healthcare is not just about hospitals, treatments, and medicines. It's about changing lives. It's about improving dignity. It's about making lives and thoughts better, making better human beings, transforming generations. So आज हम डिस्कस करेंगे about her journey in care for health, about Pakistan's landscape, health landscape. So, ma'am, who was Ambreen Bashir Haris before Care for Health? Tell me about your journey.
All right. Thank you, Mavish, firstly for inviting me.
Always a player.
So, and this is a very interesting question that you've asked me. Who was Ambreen Bashir Haris? So, for me, I think I was always an educationist.
Okay.
I was always in academics. So, I started my academic journey back in 2002, and I started teaching. I was teaching organizational behavior, and I was teaching management subjects. I was teaching marketing. I was my academic journey started in Institute of Business Management, which at that time was CBM.
Mm-hmm.
And following that, then I went abroad. I continued my journey. My interest was always in mental health because my background, my undergraduate degree, was in applied psychology. But at that time, when I had to pursue my master's, so at that time, mental health was very stigmatized. People did not understand this field. There was no scope to, like, to for jobs, especially at that time. So I'm talking back in the late 90s. So when I completed my
Graduation.
bachelor's, so there was no scope for that. So post that, I did my MBA. So after MBA, I started teaching, and then I went abroad. I did my graduate diploma in business research. I was teaching in University College Dublin and Dublin City University as well. With that, I was doing some certifications also. Fast forward to 2009, I came back. I continued my academic journey back in Institute of Business Management.
Oh,
this
okay.
time under the marketing department. Slowly, gradually, I was working with that. Then I had always had the passion to do my PhD. So currently, I'm a PhD scholar in management sciences.
Wow.
And so this journey of learning has been continuous and consistent. So, and I really enjoy the process of learning.
That's great.
Now, so I think if, and I really enjoy working with young people. And then really over this time, I think I've really understood, and especially having my own children also approximately the same age. So I think I really understand what young people go through also. I really understand. So I've seen, like, since, say, if I talk about 2002 to date, I've seen the ups and downs, the changing of technology, the innovations, how the world has changed, the problems. Then we have faced a pandemic also. So I could really understand young people. So young people, before even I was in Care for Health, they had been coming to me to discuss problems, and so I would say that I really feel what they go through. I really can empathize with them actually.
Okay.
Okay, so how it started. So back in
What
2000,
inspired her and you as
yes.
well?
Okay, so what's how it all started was that it was back in 2012 actually.
Hmm.
My daughter was in Ireland because we had moved from Ireland
Hmm.
back to Pakistan, but she was completing her bachelor's, so she
Hmm.
was there. So in between her bachelor's and then she completed her MPhil also. So her MPhil was in translational medicine.
Hmm.
So she completed that, and because there in Ireland, you save a year because they don't have an O level A level system. So they
Okay.
have a junior cert and a leaving cert system.
Okay. Okay.
So she was pretty young. She was 21, 22 years old. So she came back to Pakistan for a break, for a gap.
Hmm.
And within that gap, she had another friend who had come from Mount Holyoke in America, in the
Okay.
US,
Okay.
and she had done a degree in psychology. So
Hmm.
they both came here in Pakistan and they had a gap year. And in that gap year, they decided that, okay, we really see a problem that mental health is there, one. And but the problem
Stigmatized.
stigmatized, it's there. We had Karwane Hayat at that
Hmm.
time, it's
Exactly.
still there.
Hmm.
So she said that what we must do is that even mental health patients who are psychiatric patients, they get treatment from the hospitals, from psychiatrists. At
Hmm.
that time, clinical psychologists weren't too popular like
Exactly.
they are at this point in time.
Exactly.
So at that time, most of the mental health patients were having severe problems like schizophrenia, bipolar disorder, psychosis, OCD. So these kind of severe depression. So these patients would go to psychiatrists in hospitals.
Hmm.
So what they were trying to do was they said that these patients have no other option even when they have been treated, they are on psychotic medication.
Oh.
This, despite that, they cannot reintegrate into society.
Exactly.
People don't give them jobs,
Never.
and that is still the stigma to
Still
date.
here.
Yes, the
I
people
agree. I
who have
agree.
actually said that we have a mental health issue, I don't think people want to give them a job.
Never, never,
Right,
ever. They are still
exactly.
stigmatized. Why are you here?
Yeah, and people think that maybe they'll have a relapse or something, so maybe we should not give them a job.
Hmm.
So this was the problem gap that they identified back in 2012. So what they started was they said what we'll do is we'll start a referral system with the psychiatric hospitals. So psychiatrist will give a referral to the psychologist, and the
Okay.
psychologist will maintain for at least 6 to 8 weeks an illness management and recovery program. This program was called IMR program. It was a foreign resource kit. We are still in touch with
International.
Professor Kim,
Yeah.
and he's in Boston, and
Yeah.
it's a resource kit developed by Professor Kim.
Hmm.
So they, under his supervision, so they developed an Urdu version of the kit,
Okay.
and so it's a very structured program. So anyone who was suffering from severe mental health illness like
Mm-hmm.
schizophrenia,
Hmm.
you've done psychology, so I'm sure you know,
Bipolar. Exactly.
bipolar, OCD, so any severe
Exactly. I
problems.
understand.
So they would go to a psychiatrist,
Hmm.
and our psychologist from Care for Health would also go to the JPMC or civil hospital or Karwane Hayat,
Bilkul.
and both will work together. So
Okay.
one will give medication and treat the illness, and the other will actually help them manage the illness through the IMR program
By giving psychotherapies
by
and
giving psychotherapy.
behavioral
This was
therapies.
done through group sessions. The target market was very underprivileged people, very
Yeah.
underprivileged, who
Hmm.
would go to these hospitals.
Hmm.
So this was the business model that they
Okay.
adopted, and completely it was going to be on funding, on
Hmm.
charity.
Hmm.
And at that time, back in 2012, so they started doing local funding, individual donors,
Okay.
so only local funding.
Okay.
So this is how it started. So 2013, they did. We got it registered.
Okay.
The Care for Health, we got it registered, and at that time, clinical. It wouldn't be clinical. We did what do you call it? Pilot studies with
Okay.
the IMR in this program, and it was quite successful.
IMR is International Management
No, no,
and
it is illness management
Illness.
and recovery program.
Oh,
Yes.
illness.
So this is how it all started. And then,
Okay.
of course, my daughter, she did some charity fundraisers, they did concerts. We were all part of the fundraising, of course, at
Hmm.
the back, because it was,
Okay.
yeah, but they did a lot of work. She and her friend, they both did a lot of work at that time. They were young.
Hmm.
Moving on, she went back to study. She to London
And you
this
were
time,
here to
and
handle this.
her partner,
Hmm.
she also started another organization which was for profit organization. So it
Okay.
is also doing mental health, but
Okay.
it is a for-profit
The target
organization
mark is for,
for
premium.
the a bit premium, and also in the Middle East.
Okay, okay,
So, and it's for profit.
okay.
Because in Pakistan, running a charity organization,
It's very hard.
it's very, very difficult, especially in the field of mental health. Firstly, people
I
don't
understand.
understand mental health that much. They still have started to talk about it, but getting funds in this field is very difficult. You have to go for foreign grants, international grants,
Okay.
because under the United Nations or under, there's so many other grants which are coming now
Exactly.
in this field, in this particular field post COVID. But before that, there was nothing as such. अब तो कॉर्पोरेट में भी करते हैं वेलनेस सेशंस, तो
बिल्कुल
अब तो इट्स बिकमिंग काइंड ऑफ
हॉस्पिटल्स में
ट्रेंडी
करते हैं, स्कूल में करते हैं,
SEL trainings हो रही
बिल्कुल
हैं,
ऐसे।
there's so many things that now people are talking about. Celebrities
Exactly.
are coming forward and talking about their mental health.
Especially after
Social
COVID
media is
thing.
really talking about mental
Exactly.
health.
That's
So
true.
post COVID, okay, fast forward 2019, I think. Um, it wasn't doing too well because, of course, both the partners had kind of they were giving it some time, but not too much time
Not
they
too
could
much
give.
time.
Okay, and my daughter had gone back to London also. So then COVID hit in 2019. The funding kind of stopped.
Oh, okay.
Yeah, our team really was quite less,
Oh.
and because of course you need a captain of the ship. You can't like
Exactly.
it can't work. You need that
You need that leader.
yeah. So back in 2019, they started talking about like okay, either we dissolve Care for Health or we like revamp it or we bring somebody new.
Or maybe merge it something, merge it
Yeah.
with any.
Exactly. So maybe we should like there has to be some decisions to be made. So they discussed with us also like the families, and because it's a family setup. So I decided that okay, I'll be the face of the company. And I always had the passion. I had my degree in psychology, and I always understood this work. Actually, I actually understood this work. I saw my daughter doing it all the time, so I could kind of like knew the
You were connected to this
I was
all,
connected to
all
it.
the time.
And I really thought that they had really worked on it,
Oh.
and they had really started it with a passion. So I didn't want
You didn't want to lose
all that. Like, so I said, okay. So during COVID, so we started. Best thing about COVID as an as an opportunity
Okay.
for a company was that people went hybrid. So a lot of things started happening online. So you could save on a lot of overhead costs because so at that time I took it upon myself to build a new team. And I restructured the whole organization back in 2020, I think. So when COVID was a bit down, the problem, another thing was not just the funding. The problem was because of the lockdown, the patients who are underprivileged, who already had a lot of problem coming to the hospital to get the medication, they could not go there. It was lockdown.
That's true.
So that was our main beneficiaries, so they could not reach the hospitals during lockdown. The funding had become very
So you
less.
directly targeted them.
Yeah. No, so what we did was, so we just restructured it. And 2020, this is social media now, very active, Instagram, very active. It's people talking about lockdown, people talking about isolation, people talking about, and not just severely severe patients, young people talking about it, people having like people who had lost, like you talked about bereavement earlier, and people who had lost some loved one, or people who had gone through this problem or this disease, people who had faced loneliness and isolation
And they
during
can't
this
talk
time.
about it.
Yes. So they also started reaching out to us. So it was, I don't know, it was, we also reached out with marketing and everything we did. But people also started reaching out, so we restructured the whole thing. So we said that okay, we are going to have one thing which is illness management and recovery, which will still be in collaboration with the hospitals. But within that, we will also now build a panel of psychologists, clinical psychologists, who will provide counseling and psychotherapy to mild and moderate issues. All. So this is what we decided, and then we also decided that we will also spread mental health education, break the myths, break the stigma.
That's more important.
Yes. And then, of course, one important part that we do is community outreach. So we partnered with like these places like Kashif Iqbal Thalassemia Trust and Siratul Jannah and all these different places, old homes. So we thought we'll go there and we provide them well-being services as well.
Hmm.
So, and we also partnered with schools and we thought we'll provide them social and emotional learning
Exactly.
trainings, because this was the time when everybody was talking about this. Then we also started corporate training sessions that where psychologists
Hmm.
also go. And then we did a lot of sessions with universities. So my network is mostly universities because I've been in the education sector for such a long time. And I think young people like you, especially Gen Zs, are those people who are very good in articulating,
Identifying and
identifying the problem and also articulating it. Okay, this is
what?
what they're going through, and they very actively seek help. And
Yeah.
it's not like they need to have a severe problem in order to seek help. They can just seek help. They'll take just a couple of classes, like a couple of sorry sessions, and they will feel better.
And
And they'll
actually,
just do a catharsis.
exactly,
Yeah,
they understand the importance of catharsis, okay, how it's important to talk to someone who can empathize.
of course.
Exactly.
So we increased the scope of our organization. I think it really worked with us,
Hmm.
and so I think during that 2 years, and the opportunity that we had was that things were going hybrid. So
Hmm.
with hybrid, a lot of people started doing online sessions also. And
True.
sometimes people also wanted online, and especially with the mild ones, mild and moderate type of problems, online wasn't such a bad idea because you could have a camera on. It was
Okay.
all the we learnt actually.
Hmm.
There's a protocol to follow for an online session also.
That's true.
So we also learned
Hmm.
with as the industry evolved. So the
Hmm.
industry has evolved. I can see now there are so many other companies who are doing such good work.
Hmm.
और मैं तो ये कहूँगी कि कतरा कतरा ही समुंदर बनता है.
That is true. That
तो
is
हम लोग तो काफी पुराने ही थे इस इंडस्ट्री में, बट अब इतने अच्छे
again
अच्छे लोग
evolve हो रहे हैं साथ
इवॉल्व हो
साथ,
रही है. कंपनीज आर
improvisations
कमिंग,
आ रही हैं.
specialist companies are coming. Some
Hmm.
companies are only organizations are only dealing with
Hmm.
trauma only.
Hmm.
So people are coming out and they're really talking about mental health and emotional well-being and industry. And इससे फायदा क्या हुआ है कि there's always an implication. So what happens is that now in universities, now in organizations, the employees, the management is
Hmm.
also a little bit careful about the well-being of their
Well-being.
employees,
That
the
is true.
well-being of their students.
True. True.
So
True.
I think एक बड़ा अच्छा, it's a good thing. Definitely there are some challenges also because there are a lot
Has
of
always
quacks.
been.
There's a lot
Exactly.
of unqualified people also in this field.
बिल्कुल.
Everybody I think now says that we can like provide therapy and we can provide this. One thing I was very careful of when we started, because Care for Health did not want to have any liabilities.
Hmm.
So we were very clear that all the psychologists that we have will have to be qualified. So they would have to have some recorded sessions done, which were requirement.
Okay.
There's a requirement ना
जी
that
बिल्कुल.
आप करते हैं तो फिर आप सेशन ले सकते हैं.
सही.
दूसरी चीज़, they needed to be graduates from either Bahria University, IPP, or
Better
ICP,
university.
ICP
Mm-hmm.
Institute of
Clinical
Clinical
psychology.
Psychology in
जी.
Karachi University. So हमने एक distinction थोड़ी सी की कि okay, so then we are very clear on where the psychologist is
बिल्कुल
coming
बिल्कुल.
from. So this is how we did, and I think
We
Alhamdulillah,
came up very good.
it's doing well. It's still a tough industry, especially when it comes to raising funds,
Hmm.
people giving funds. So, for example, if we want to conduct a ration drive,
Hmm.
so थक करके आते हैं पैसे. So Ramzan में, people keep on giving us money for the ration drives
Okay.
because that's something I think tangible. People can see there's a
People
bag
can see.
that you can are giving. So when we ask people to maybe sponsor
Hmm.
a client for a few sessions, and it's
Hmm.
a very affordable session that they can. Of
Mm-hmm.
course, the psychologist needs to be paid at the end of the
Exactly.
day.
Exactly.
So जब भी हम उनको कहते हैं तो वो थोड़ा सा होता है कि you can't see it, you can't see the service, you can't see whether it's helping or not.
Hmm.
So I think वहाँ पे थोड़ा होता है. बहुत से लोग, लेकिन बहुत से हमारे साथ चलते हैं, बहुत से लोग बिलीव भी करते हैं इस कॉज पे. But still, yeah, it's doing well, I think. Yeah.
Great, great. So what I see the toughest moment, yeah, tough moment is for you guys is to raise money, right?
Raise, yeah,
इस सारी
and break
जर्नी में
stigma
सबसे
and break
मुश्किल.
stigma. Now we are part of United for Global Mental Health. Also, we are a working group of that. We just signed MOU with this International Federation of Students, which is the 1950s की है. अभी हम
Wow.
इस मंडे को ही कर रहे हैं. नॉर्थ साइप्रस के मेडिकल स्टूडेंट्स के साथ. लास्ट वीक वी डिड विद मेक्सिको स्टूडेंट्स. सो इट्स मेंटल हेल्थ एजुकेशन पे हम काफ़ी वर्क कर रहे हैं. Then we're part of the Pakistan Mental Health Coalition since the beginning when it started. We're core
Okay.
members of that organization also.
That's
So
well.
chal raha hai, but yes, funding is difficult. Of
It's
course,
the
it's very
toughest,
difficult. It's the toughest part, I think.
toughest part.
And it is also toughest part to ask a client to pay
Mm.
because the thing is they think कि बातें करने में
यहाँ
क्यों
पे
लोग payment लेते इतनी ज़्यादा.
exactly और यहाँ
So
पे
I
तो हम
think that is a
यार
very big stigma as well.
Okay, so what do you think is the like key decision you made after joining Care for Health that restructured it? As you told me that your daughter and her partner went away, and you know people were talking
Yeah.
about to dissolve it. So what do you think? What has you changed, and what decision has you made जिसके आने से ये restructure हुआ and it uplifted?
I think the biggest first thing I did was remove all the overheads.
Okay.
Yeah, I said that
Right
we have to,
sizing.
yeah, I did remove the overheads. Like you have to do that.
Yeah.
Build
Agree.
a new team,
Hmm.
get amazing psychologists on the panel,
Hmm.
and also restructure. Think that we are going to restructure. Like it's
Okay.
we need to have if we want to run this organization,
Hmm.
we need more than just the IMR program because
Hmm.
IMR program was still new in the market. Still, you do not study that in our colleges. It's not part of the
नहीं,
syllabus.
we don't. We
So
don't.
IMR is not part of the MPhil syllabus. It's not part of your undergraduate syllabus. It's not part of that syllabus in psychology
Exactly.
in Pakistan.
Not yet.
So something which it's an amazing program, I would say. JPMC is still running that program.
This IMR.
IMR
Okay.
JPMC के साथ सवेरा करती है like
Okay.
in partnership, and Savera came after Care for Health,
Mhm.
but Savera really works on, it also does like our thing like counseling and psychotherapy, but it also
Okay.
works on IMR just like Care for Health works with
Okay.
IMR. Yeah.
Okay.
So ये दो organizations का मुझे पता है जो actually work करती हैं, जो certified हैं to work on IMR program.
सही.
But otherwise I think that's the biggest decision I made actually.
Right
Okay, we
sizing.
need to increase the scope of our work.
Okay.
If we want to be in the market, the time is changing, the trends are changing, the opportunities are there, the challenges are there, of course, but we have to increase the scope. So that's the first, I think, my first recording as a CEO, which is also you can find on our website,
Okay.
is saying that we are changing the scope
Okay.
of our work during the
okay.
COVID. Yeah.
Okay, okay. So, okay, okay. So, what mistake do you think was made जिसकी वजह से आपको लगा कि नहीं यहाँ से मैंने बहुत कुछ सीखा है दिस इज नॉट गोना हैपन अगेन एंड आई विल करेक्ट इट एंड इम्प्रोवाइज थिंग्स इन फ्यूचर एनी मिस्टेक और एनी नो रॉन्ग I won't say wrong decision, but again, mistake or something didn't the way you wanted.
अच्छा बहुत सी मिस्टेक्स है of course like I teach blue ocean, I teach strategy canvases, I teach all this.
Okay.
So teaching something and actually putting your hands
Into that particular thing.
No doubt my academic knowledge did help me a lot because you have no idea how many business model canvases I have drawn in my life.
Okay.
Yes, for Care for Health. Yes, so definitely all that academic knowledge could be applied, of course, but definitely the market is different. So there have been so many mistakes. We first thing was that some psychologists, what I found was that I made sure that I interview the psychologist myself, because one thing which I faced
The one you are hiring.
the one we are hiring.
Okay.
So one psychologist, sorry, when I started being part of Care for Health, so one thing that I felt was that some lacked soft skills.
Okay.
And some lacked empathy. So that was important for me because I thought the client is already coming in distress. So if you are actually so much looking at your watch and you're constantly okay, आप देर से आए हैं, आपने time पे join नहीं किया, आप and you're not like giving them even a little bit of, and you're scolding them. So I have very big problem with that. So I feel that soft skills are very important. So this is one thing that
especially
I learned.
for a psychologist.
Of course. So definitely we made a lot of mistakes. We did some collaborations, I think, which didn't work out. We did some MOUs which we thought were good,
Hmm.
but
They weren't.
they weren't, in the sense that there was they, the other party only needed the MOU, and they did
Ah,
not want to do anything. Like,
okay.
so I'm not a very big fond of like it's not a
Verbal
bit
or paper things,
this
right?
many. Yeah,
Ah,
I understand documentation. Of course, you need documentations, you need contracts,
of course.
but I think end of the day there has to be some work, even if it's little work. So this is the
Hmm.
first question I ask in my class also when I start teaching. I
Hmm.
say that, my question is not like 5 to 10 years में आप कहाँ देखेंगे अपने आप को.
Hmm.
So I always like to ask them कि in 5 years time, how do you think of yourself as giving back to the universe? Because maybe I'm in the field of social entrepreneurship,
Hmm.
I'm in the field of this NGO. I
Hmm.
like doing social work,
बिल्कुल.
and I'm not just part of this organization. I've been part of multiple other
Multiple things.
organizations who are doing social work. To date, I'm still part of a lot of other organizations which
Wow,
are doing
great.
that. Yeah, like that there's a Samina Alvi Breast Foundation, breast cancer
Ah, yeah, I heard
prevention.
about that.
So I'm
Hmm.
part of that also. Then I'm part of this OAKS, which is an old association of Canada, which works a lot with NICVD patients.
Hmm.
So but I do very, like, I do just a participant kind of work there a little bit, like a volunteer work. But what I'm saying is that
You
I
enjoy
I enjoy that there
huh.
has to be something which is being done.
Hmm.
Uh, थोड़ा
Practically
करो,
accomplishment में
हाँ,
आ रहे हैं, हाँ.
थोड़ा हो जाए बट कुछ हो. So I think ये है, I think mistakes ये भी थी, recognizing people.
रिकग्नाइजिंग इवन कंपनीज के जो लोग सिर्फ अपनी वाहवाही के लिए एमओयू साइन कर रहे हैं बट
Yeah,
दे आर नॉट वर्किंग एंड दे आर नॉट इनपुटिंग इनफ राइट.
exactly.
हाँ.
And then I also realized one more thing was that, and I was very much for, I'm very much still for collaborations. But then I also realized that some people only would like working in silos, maybe like their own thing.
बिल्कुल बिल्कुल.
Yeah. So you
सही.
understand people when you go into the field and you start working, especially in the field of social work. But I would say that I have met a lot of amazing people. I've learned so much. There are so many amazing. Like, I always say the name of Savera. I think Dr. Yasmin is doing an excellent job. She was in the US. She came back, and she's really,
For the social work.
yeah, she's really doing a good job with Savera. So there are organizations who are doing a lot of work in mental health. Yeah.
Yeah. Okay, so like I see lots of challenges and still you are going great. But when we talk about business or any entrepreneurship, we talk about as well money.
Yes.
So how do you handle, do you generate enough revenue to handle everything you're talking about, and what challenges do you face? And if you have limited resources, where do you would like to invest first, and all about your
Yeah.
revenue and money.
All right, say of course. As I said, I make a lot of business models. I love making the strategy canvas. I love, like, creating a
as
blue
it is.
ocean for this care for health also. But at the end of the day, that paper has to be converted into some application. So yes, as I said, when I joined, first thing was, again,
Money.
money. Remove. I had 11,000 rupees in the account only. Yes,
Wow.
this is how I joined, because of course before that, in a couple of years, it had gone a bit down.
Oh my
The founders had actually found new
God.
interest also, and it was right because
Okay.
they were in their early 20s. They had to do their masters. They had to grow, or maybe I was at that stage where I wanted to give back to the universe, and I'd gone through those stages of making money and all those
Oh,
things. Yeah,
exactly. And the founders were actually at that
they
stage.
were at that,
They
still
have to
young.
go for
Yeah,
money.
and they do a lot of social work, no doubt. They're very good. Both still do a lot of social work, but of course you have to give it your all if you're running an
Exactly.
organization. So the first thing, as I said earlier also, is that you have to remove unnecessary cost. You have to have a lean structure.
Hmm.
So we have a very lean structure at Care for Health. We have very minimal cost,
Okay.
overhead cost especially. We have very minimal. We have an office. Then we changed it, and because a lot of our psychologists were doing online, like our clients come and we do online.
Okay.
So we do workshops which are in person mostly. So we have a plan where we generate revenues.
Strategy.
Yeah, we have that strategy where we try to remove the overheads as much as we can.
Hmm.
We don't uh, बिलीव मी महविश, छोटी छोटी चीज़ों में इतनी कॉस्ट इनकर होती है, इतनी कॉस्ट इनकर होती है कि आप अगर एक पेपर हटा देना बीच में से, सो यू सेव सो मच मनी, राइट? ये जो आपके नहीं, ये जो there's so much money, then there's so many overheads, then we did a lot of we used multiple models uh, for raising revenue and decreasing cost. So we did that, and we do fundraisers. Then we have some individual donors, but to make it more sustainable, what we did was post-COVID, in the recent years, we opened our doors for affordable counseling also. So we changed our what do you call it, our positioning, or we changed our mission to provide more affordable, accessible, actionable, and approachable. So approachable to all segments. So very poor people also come to us, middle class people also come to us, because we give them affordable. People, if they come to us and they are not able to afford, we take a minimal.
So there is no fixed thing, right?
There's a fixed thing with the psychologist.
Okay.
Right? There's a fixed thing that we
Not
have to
for
pay
the
the psychologist. But then we can do a little bit up and down. We see if there's a poor person, we will not charge them, but we will pay the psychologist.
Okay.
Right? So we have to raise a welfare fund. So for that purpose, we have donations, right? And then we have people who come, like young people, maybe they cannot afford the complete fees of the psychologist. So we give them kind of a subsidy. Then there are people who can actually pay, and they are able to pay for the most expert psychologist, because there are some psychologists who really charge high.
I can understand, because I first checked the psychologist back in like 2-3 years, and his fees was 40,000.
Yeah, अब सोचो ना.
I was like, what?
That's a lot, by the way. ये एक दिन की थी.
One session or maybe 2 sessions.
Wow,
that's a lot.
Then we are very, very, very affordable. I think we are super affordable. And we have got good psychologists, alhamdulillah. So हमने उनके साथ भी ऐसे किया कि we never, like, you know, so it has been a very good partnership with our psychologist also. Yes. So you're absolutely right. So revenue, और हाँ fundraiser करते हैं. So we actually founded an annual event which is called Zen Fest. उसको last media coverage पे मिली थी. अभी हम फिर कर रहे हैं इस दफा. Maybe we'll do it in the end of summers, actually, not in the winters. Usually we do it in July. Irtiza is one of our volunteers there as well. So हम करते हैं, उसमें हम काफी fundraise करते हैं, because जब event एक kind of a tangible services दे रहा होता है साथ, तो vendors भी आते हैं आपके पास, और उसके अंदर हम क्या करते हैं, different, like a wellness festival. So what we do is we have workshops in that, we have vendors in that, so it's a very and it's also my point was to actually talk about mental health out in the open, talk about emotional well-being, so bring mental health and well-being to the limelight.
Sounds interesting.
Yes, so it's pretty interesting.
I would like to visit too.
We have done 2 very successful Zen Fest events. Wow. So हर किस्म उसमें panel discussions भी होती हैं, workshops होती हैं, and then we have vendors, all kinds of vendors,
pamphlets and everything, you know.
Yeah, we do a lot of marketing for that. Yes, exactly. Of course. We have sponsorships from companies in that. Big companies come. Chop Chop Walk was one of the vendors. Colonel Pop was one of the vendors. Soya Supreme was one of the sponsors. Blue X was one of the sponsors. So we get a lot of good sponsors who believe in the cause, and they come and join us. And then a lot of NGOs also join as vendors in the event. Abhi IRD was joining us once. Then last year तो coverage उसको उसकी भी मिली थी. मिलकर campaign है जो तस्कीन और British Asian Trust ने start की है. So this is with Jio. Okay. So Khalilur Rahman. Yes. So they also gave coverage on Jio to our event. So yes, so this is one of the fundraisers which we use for revenue generation. It's a lot of work, so we have a big team for that. And the thing is,
sounds interesting, but you know, very much challenging.
Yeah, but we find good people. I think लोग join कर लेते हैं, लोग
for good cause.
For the cause, young people really have a lot of passion. I think young people have so much passion. Half the decoration is done by young people voluntarily.
Yeah, I guess because they understand the importance of mental health. Yeah. They understand the cause behind your work. Yeah. So that's why they are, you know, willing to come.
And I really appreciate that, because हम लोग तो मैंने जब लिया था, and I was thinking, okay, like, you know, okay, we have no money.
We have no money.
And we have an office, we have overheads, like, you know. तो पहला तो मुझे 1 साल लगा सिर्फ overheads उतारने में, जो बाहर चढ़े हुए थे, तो वो किया. But alhamdulillah, I got support from the founders also. I got, like, they're also the trustees.
Right.
So it
Say, so in Pakistan, how do you think that technology, especially in your leadership era after 2019, how technology has improved and will improve cure for health?
I think it's all about technology now, but
Hmm.
you have to be very careful also.
Okay.
So we did a podcast with one of our psychologists, which
Hmm.
was specifically on social media actually,
Okay.
that how social media or AI tools are misused also sometimes. Like people have made ChatGPT their therapist, in the sense they ask ChatGPT,
Yes,
ChatGPT, I'm feeling sad, this is happening, you know.
this is routine thing. This
Yeah.
happens.
Yes.
Huh.
So they're doing that. So AI के बगैर तो हम कुछ नहीं है. Now we have to understand how to use it in a ethical way, right? So how much to believe in that, how much
How
not
much
to
to do?
believe in
That
that.
is true.
That does not, I think, minimize the importance of the clinical psychologists who have been trained in this field,
Hmm.
right? So I would never say, oh, but yes, AI is there, technology is there. Technology has helped care for health a lot, thanks to the Zoom and the Meet and the
Hmm.
online hybrid
Online
systems.
meeting,
A lot
exactly.
of our workshops, like this workshop that we do with the International Federation across countries,
International levels,
at the international
globe.
levels, how we have become part of the United for Global Mental Health. It's not like we go there. It's
Mm-hmm.
all these working groups are online.
Exactly.
So I think it's to spread and to increase our visibility and to showcase our work and to get clients also. Like,
It's true.
people who are, and a lot
People
of
search
people,
for,
yes,
wellness
who are
centers.
giving online. Yeah. So I
Hmm.
think
I understand.
without technology, now we are nothing. Nothing. You checked our website before inviting
Yeah,
me, so I'm
I
sure.
did. I did. I
And
did.
the next step is, I think, how to integrate. So I was thinking a bit recently along the lines
Hmm.
that how to integrate AI, how to integrate chatbot, how to
Chatbots.
maybe create an app for Care for Health where we connect the psychologist with the client,
बिल्कुल
but in a
बिल्कुल
very
बिल्कुल.
ethical way. How would it work? Can we actually do use an avatar
Hmm.
within the apps, who can actually, because sometimes the patient does not like to show their face, so maybe they want to, like this, because one of my study
Hmm.
in my MPhil was that how much people have started, especially the young people, Gen Z and Alpha,
Hmm.
have started identifying with their avatars on multiple channels like gaming and on WhatsApp. And when they want to show their
They
emotions,
try
even they
this
use some
and
kind of an avatar, some
हाँ
kind of
exactly
a
they do.
emoji to
Emojis,
express
avatars.
themselves.
बिल्कुल बिल्कुल
So
ऐसे
I
ही है.
was just thinking that how can we integrate that together? So let's see. Let's see. You need a lot of money for that also,
Exactly.
but the ideas are there on paper, no doubt.
Especially in Pakistan, this is
Yeah.
very challenging as well. So I have read this thing in your website, and as you just mentioned, accessibility, affordability, and something like
Yeah.
this. So in Pakistan, what do you think is the main thing, like affordability, accessibility, or one another word was
Approachable.
approachable, शायद.
Yeah.
Yeah.
I think तीनों
Affordability,
चीजें.
accessibility, or awareness. In Pakistan, which one is more demanded, challenging, or needed?
I think they both work together. They're very interdependent.
Hmm.
Because affordability is a problem, because people don't understand that why should they pay for these services,
I guess
and even
awareness,
in the
नहीं?
upper segment it's a problem.
Hmm.
But again, because they have no awareness, so as I said, it's
Awareness is,
interdependence. All
yeah.
these things are interdependent. Another thing is कि, okay, people are able to afford, but how do you actually access these services? Where are they? How do you reach out to them? What is the process? How do you think they are credible enough? बिकॉज हमारे यहाँ तो पुराने ज़माने के जैसे लोग
True,
हैं, वो
true.
तो यही कहते हैं ना कि आपके अंदर ग्रेटिट्यूड की कमी आ गई है, इसलिए यू आर गोइंग थ्रू दिस. And I'm a strong faith. I'm very high on faith. Like I really believe in prayers, and I really believe in praying. But having said that, I do not undermine
Hmm.
the importance of actually doing a proper catharsis with a professional. So I think both
And
things
it
should go
actually
side by side.
helps. ये
Yeah.
बहुत important है और ये help करता है catharsis. People should understand this.
Yeah.
You talk to people.
Yeah, and
So,
qualified people.
exactly.
Yeah, of
I
course.
I
Yeah.
understand.
So अब आप देख रहे हैं ना, इंसिडेंस ऑफ सुसाइड कितना ज्यादा होता जा रहा है, सेल्फ हार्म इतना ज्यादा हो गया है. देयर सो लाइक देयर सो मच एडिक्शन हैपनिंग.
Disrupted marriages,
मैं
couples,
देख रही थी,
support
जैसे वेप
system.
ही है तो वेप तो फूड पैंडा में मिल जाता है.
हाँ
वेप्स जो करते हैं बच्चे,
हाँ हाँ
सो इट्स लाइक एंड इट्स हाई ऑन निकोटीन, लाइक सिगरेट तो आप दे नहीं रहे 18 साल के बच्चे को, बट लाइक यू आर गिविंग
वेप
वेप्स ऑन फूड पैंडा, like
सी
so addictions hai, so there's so many things that young people today are going through. They want to have a financial life, they want to have a social life, they want to have an academic life, they want to focus on their careers, and in the middle of the recession, in middle of rising fuel prices and pandemics and bimariyan, and
everything.
like just and यहाँ से तो बहुत खूबसूरत लग रहा है
यहाँ
कराची.
से बहुत खूब before you came we just talking about
Yeah, this looks really pretty actually.
तो
Yes.
जैसे हम पाकिस्तान के हेल्थ केयर की बात कर रहे हैं,
हाँ.
कोई खास अच्छा नहीं है अब मेरे ख्याल से, अवेयरनेस की बहुत ज़्यादा कमी है. Secondly, if you will have to reform the Pakistan's healthcare sector, what first thing you will do?
I think
Like if you'll be
डॉक्टर्स
the
जो बन
prime
रहे हैं,
minister or health
जो मेडिकल डॉक्टर्स बनते
minister.
हैं, जो स्टूडेंट्स हैं, मेडिकल स्टूडेंट्स हैं, आई थिंक इट शुड बी पार्ट ऑफ देयर करिकुलम a course like psychotherapy or introduction to psychology,
So maybe
or
soft skills as well.
soft skills I think they learn now. I think they learn, but I'm not really sure okay, for the medical students I think we need to integrate mental health into primary healthcare. I still have faced so many doctors who will, like even your doctor, who would not empathize, who will not understand that somebody can really go through maybe PTSD, or
You
they
are
can
changing
really go
someone's life.
through uh, these, and and in our hospitals also we don't have those kind of sessions like for prenatal or postpartum.
No,
There's so
no.
many things that are missing. I think even I think everybody, because the halat aise hain, the recession is so much, or there's so much inflation, that people, and there's so much like I think shortage or insufficient financial or burdens there. Sabke, I understand everybody has some baggage that they are carrying,
बिल्कुल.
but I think थोड़ी empathy missing hoti hai. I think they should also be trained that yes, medical services are of course important, but also important are empathy, also important are
Mental wellness
or
services.
these also important are these small red flags that you see in maybe your client, that if you see like there's some few very good doctors who will actually say that okay, you, I think maybe you should also get counseling done, maybe so
There are people actually who do
हाँ,
this.
लेकिन आई थिंक हमें बहुत ज़रूरत है कि हमारी मेंटल हेल्थ, बिकॉज मेंटल हेल्थ नीड्स टू बी ट्रीटेड एज एन अम्ब्रेला. इट कैन नॉट बी अ साइलोस कि अच्छा जी अभी हम ये सारे काम कर लेते हैं, अब हम अपना MBA कर लेते हैं, फिर जाके हम अपने मेंटल हेल्थ की भी एक कर लेते हैं कुछ,
Okay.
so I think it's like an umbrella, everything falls under that, because no health
True,
is
true,
without mental health actually.
true. That is so
No,
true.
अगर आपकी तबीयत खराब होती है, you feeling sad or you feeling some kind of a burden or some kind of stress, you're unable to do anything else. No.
That is so true. I mean, these things are interconnected in someone's life. You
Yeah.
know, how can you totally ignore one part and go upper on the other part?
है ना.
So this thing is very important.
And for the employees, आपकी ये सारे, तो I think कि ये हमें बहुत ज़रूरत है. अभी हमारे जो कॉर्पोरेट में भी होते हैं सेशंस, बहुत अच्छे करते हैं लोग, कर रहे हैं, आई एम ग्लैड दैट दे आर डूइंग इट, बट आई स्टिल थिंक कि जैसे मेंटल हेल्थ अभी आएगा अक्टूबर में, मेंटल हेल्थ डे, तो एकदम से सारी कंपनीज एक्टिव हो जाएंगी कि हमें एक एक सेशन करना है इसके ऊपर,
पूरा
like just
साल
to show
चाहे
maybe on LinkedIn और
पूरा साल
Instagram.
चाहे टॉक्सिक एनवायरनमेंट रखें वो.
सो आई थिंक ये कुछ
हाँ.
कंपनीज तो बहुत अच्छी हो गई हैं कि उन्होंने अपनी रिमूव किया है स्पेसिफिकली कि लाइक देयर वेरी वेरी गुड ऑर्गेनाइजेशनल कल्चर.
अच्छा.
और ये सब चीजें आप लोग पढ़ते हैं, मैनेजमेंट साइंसेस जो कर रहे हैं वो पढ़ते हैं, आपका ऑर्गेनाइजेशनल
Do
कल्चर,
study, but
you
they are not
study
implemented.
leadership, it's all psychology. If you see, this all is integrated into
Exactly.
psychology,
It is.
right?
It is. Especially
So-
when we study HR subjects or organizational behavior or organizational culture, these are very much embedded into that.
Yeah, of course.
But until or unless we don't implement it, उन चीज़ों का फायदा नहीं होता इतना.
Yeah, of course.
Okay. So I guess we are running out of time. Moving forward, जैसे आपने अभी कहा कि किसी भी डॉक्टर को या प्रोफेशनल्स को हमें बताना चाहिए कि वेलनेस इज वेरी इंपॉर्टेंट.
Yeah.
What skills do you see in people when you or do you want in your team, or especially the candidates when you hire them or interview them? What skills do you see?
Again, communication skills is important
Okay.
for me. Empathy is very important for me.
Mm-hmm.
I want to see passion. This is volunteering for an NGO is not easy, because you won't really be paid also, right? So if you're a volunteer, because name volunteer means you're
You're not
volunteering,
paying.
right? So that means your heart should be in the right place, right?
Mm.
So if I'm like, we're doing a support group with women who had a miscarriage, or we want to do a support group with people who maybe, have gone through a divorce, or we want to do a support group with caregivers of thalassemia patients, and we've
Mm.
done all these. So the person who's moderating it and the people who are helping around, they need to have that basic empathy also. They need to, and they need to believe in the cause, you know it should not just be. So the psychologists that we have on the panel, so I interview them myself just so to understand in their talk how much empathy they feel and how much passion, was there a passion for them to do psychology,
Or
or
just a
was it
job.
just a job for them?
Hmm.
So
बिल्कुल.
I see, and these psychologists are seriously, they are so good, and I'm really thankful to them actually, that besides the clients that they take, and which is like, and besides the workshop which are also paid, um, they do a lot of volunteer work, like in zenfest, if they're doing a workshop, they
Hmm.
don't really get paid for
Yeah.
it, and they
बिल्कुल
really
ऐसे.
want to. And if I invite them to a panel, or I invite them to say, do a talk, you know they would actually do it out of the passion and out of the understanding of the subject.
बिल्कुल.
So yeah, so this is very
Communication.
important for
Hmm.
me, that there has to be the right purpose for which you have joined this particular field, because this is completely humanistic field. No matter how much AI we employ here, okay, but it's not like just general making an ad feed. It's like actually one-on-one dealing, whether you do it through Zoom, whether you do it through any other
That
medium,
that that's true.
right? Whether you
That's
do it
true.
in person, whether you
That's
do it
true.
in a group,
That's
it's a humanistic field. So your
that is
heart should be in the right place.
your heart should be in the right
Yeah.
place. So my second last question is, as a leader, as a CEO of Care for Health, what strategies have you adapted, and where do you see, matlab, again, what are you giving back to universe in like next 5 to 10 years maybe, or like next upcoming objectives, as the world is so much transforming,
Yeah.
improvising things, और मतलब चीजें change हो रही हैं, एक shift of era is here.
Of course.
So how are you gonna align with this word, and how do you see things? क्योंकि अब बहुत सारी और भी चीज़ें आ रही हैं, and
Yeah.
बहुत सारे और competitors भी आ रहे हैं मार्केट में, अगर हम business की बात करें
बहुत
या
है,
strategy
बहुत
की
है,
बात
they are.
करें. So what you're looking for in your like next 10 years maybe, or 5 years?
um 10 years time, inshallah, we'll still be there. Yes,
Inshallah, inshallah,
consistently
inshallah,
doing much better work, inshallah.
inshallah.
What we would definitely, first thing is that my main target market
Mm-hmm.
is youth. I am really connected with youth. So slowly and gradually, I see myself, while since I've joined,
Hmm.
that most of the work I do, most of the clientele that we have, most of the are either youth or women. You know, so मुझे लग रहा है कि it's not that I don't like. We really have men's mental health thing, and we do podcast on that. We have psychologists who are men also.
Mm-hmm.
But the thing is, automatically, for some reason, my concentration or my passion is youth, and helping youth,
Hmm.
empathizing with youth. I would like, and you'll see me in my teaching also, I'll give extra time
I would like
to
to.
young people if they want to talk about anything. So,
I want to
that.
take class from you.
Yeah.
I don't know, but I do
So
want
over, I
to.
think the next 10 years for the company, the business, I think we need to go more digital. I think we must have an app. I
Hmm.
think we must be able to make it more scalable.
Hmm.
Right now, we're within Pakistan only. I think we are, because we're just
We can
doing.
target MENA or Gulf
Yeah, we
countries
at
as
least we
well.
need to, and we need to be able to scale it more
Hmm.
uh, with the help of technology, of course. The technology, I was just looking at a model of TriAge, that how we can use like data, and how can we use that, how we can utilize this AI, and how it can actually uh, like you know like it can help us actually, just like for example you come to us and there's a triage on our app and it helps you with your with the initial
findings or initial
इनिशियल आपका जो भी प्रोग्नोसिस है
information.
या इंफॉर्मेशन है और वो बेसिक जो भी प्रेजेंटिंग कंसर्न है आपकी,
बिल्कुल.
और उसके बेसिस पे इट कैन कनेक्ट यू टू द राइट साइकोलॉजिस्ट
Hmm.
हु इज एक्सपर्ट इन दैट, समथिंग लाइक दैट. I don't want to give
That
all
would.
my secrets away here.
Okay.
Yeah, I'm still not done, not still done it, but I really want to
Cool.
scale the work of the
I
organization,
guess
and I
not five
believe
or
because
10.
I've been really working on it, I've really made plans for it. I just don't
Uh,
have the money for it at the moment, and
okay.
somebody who is
I hope you
really
get
might
it
be
soon.
invested in this. So I would like to do that. Yeah,
Okay, great.
I think maybe and in that also I think I would rather do it with some young entrepreneurs who are who are have their projects like that in an incubation center, so that they I want, like as I said, I want the young people to grow. I've lived my life. I think I've uh, uh, done what I could do. I'm still a learner, I would say, but
Of course.
I think it's your time.
I guess like 5 to 10 years is like too large span. You should do it like in
पता भी नहीं
1 year.
चलेगा
One
10 साल
एक से
का.
2 साल में आपको करना चाहिए. Okay, fair. As a
I
CEO,
wish I'm trying to
inshallah,
do it कि
inshallah,
हम कर
inshallah.
लें, but inshallah 10 years में if a young person needs help, I think I want to be, not me, but Care for Health should be the first organization which comes to their mind.
Okay.
Yeah.
So, as my last question, as a CEO of a wellness center, Care for Health, what advice would you give people like us, as we talk about youth and women and like people or doctor who are looking at you and who are listening to you as well? What advice would you give about mental health?
As I said earlier, I think there's no health without mental health. You have to really take care of your mental health. I think uh, you should we have just if you see on our Instagram, we always talk about press, the word press, the Care for Health way, which means that prioritize your mental health, recognize the symptoms,
PRESS.
yes,
Uh,
and understand and evaluate your triggers, kya hai
okay.
triggers, and of course self care,
Self-care.
and
True.
seek support. And don't
Wow.
have to go for a professional help. You can just seek support from your friends, your family. You need to talk about it. I think everyone should know psychological first aid, especially if you're working in organizations or you're studying. Everybody should know psychological first aid. You should know the signs that your friends might show that they're going through something. And for that, I think all young people need to have again the empathy. And I think young people have it. I see the young people today as compared to me as a young person. When I was a young person, I think our goal, the world was better, and I was brought up where I could cycle on the road without anybody kidnapping me. Seriously. And but today I'm really scared for my own children. Where even if they're going in a car with a guard, I'm scared. So I feel that the young people have grown up in that. So because of that, they're very empathetic. They're very passionate to help. They really
बिल्कुल
like to
बिल्कुल
volunteer. They're good
बिल्कुल
people. We
बिल्कुल
need to actually polish and really वो क्या कहते हैं, तराशना पड़ेगा इस goodness को. They just need a bit of guidance. I think young people, and another thing, I think take it slow. Yeah, that is one thing that I want to tell all young people. Please take it slow. ठीक है, टेक इट स्लो. ज़रूरी नहीं है कि फौरी तौर पे आप पैसे वाले बन जाएं. टेक इट स्लो, टेक इट ग्रेजुअली. यू विल रीच वेयर यू आर सपोज टू रीच इवेंचुअली. स्टे फोकस्ड, स्टे कंसिस्टेंट, like do hard work, keep on doing hard work, but take it slow.
Stay consistent.
Take it, yeah, stay consistent,
Okay.
but take it slow and be happy. Be happy in small things. Enjoy your college times. Enjoy the मैं बड़ी हैरान होती हूँ, मैं जब MBA की क्लास को पढ़ाती हूँ और वो कहते हैं कि उन्होंने कोई अटेंड नहीं किया इवेंट, फॉर एग्जांपल सोल फेस्ट नहीं अटेंड किया, या इस तरह की जो चीज़ें यंग लोगों के लिए होती हैं, तो आई ऑलवेज टेल देम प्लीज अटेंड दीज थिंग्स.
These
क्योंकि
are for
एज में
you.
enjoy करते हो and you need to like take out time for yourself, go with friends,
Okay.
do only good things, but yeah,
That's
but yeah, you must, yeah, stay happy.
Thank you so much. It was great time, and again, we really, really should care for our health. Thank you so much, Miss
Thank you so
Ambreen.
much.